Top 20 Nursing Assistant NH Interview Questions and Answers. Prepare for your next nursing home interview with these top 20 nursing assistant questions and answers. Gain insights, boost your confidence, and showcase your skills to succeed in long-term care roles. 1. Why did you choose to become a nursing assistant, and what motivates you to work in a nursing home? I chose to become a nursing assistant because I've always had a strong desire to care for others and make a positive difference in people's lives. Working in a nursing home is especially meaningful to me because it allows me to build lasting relationships with residents and provide them with consistent, compassionate care. Many elderly individuals need daily support and companionship, and I find it deeply rewarding to be part of their journey, offering both physical assistance and emotional comfort. Knowing that my presence can bring ease and dignity to their lives keeps me motivated and passionate about my work every day. 2. What previous experience do you have working with elderly or disabled patients? I have hands-on experience working in both home care and long-term care settings, supporting elderly and disabled patients with their daily needs. My responsibilities included assisting with personal hygiene, mobility support, meal preparation, and medication reminders. I've cared for individuals with dementia, Parkinson's disease, and limited mobility, tailoring my care approach to each person's condition and preferences. My experience also involved collaborating with nurses, therapists, and family members to ensure holistic care. I developed patience, empathy, and strong communication skills through this work. These experiences taught me to be attentive, proactive, and deeply respectful of each resident's dignity and individuality. 3. How do you handle the physical demands of being a nursing assistant, lifting, transferring long shifts? I maintain good physical health through regular exercise, stretching, and proper nutrition to meet the physical demands of the job. To prevent injury, I follow proper body mechanics and use equipment like gait belts, slide boards, and lifts when necessary. I always seek assistance from colleagues when handling heavier transfers to ensure safety for both the resident and myself. During long shifts, I manage my energy by staying hydrated, taking brief mental breaks when allowed, and maintaining a positive attitude. Experience has taught me to pace myself and remain focused even during physically taxing tasks, ensuring consistent and safe resident care. 4. Can you describe a time when you provided emotional support to a resident or their family? I once cared for a resident whose spouse had recently passed away. She was withdrawn and tearful most days. I made time during my rounds to sit with her, listen to her memories, and offer comfort. I gently encouraged her to participate in small group activities and coordinated with the facility's social worker for further support. Over time, she began to re-engage with others and seemed less isolated. Her family later thanked me for the emotional care I provided. That experience reinforced the importance of compassion and empathy, and how emotional support can significantly improve a resident's overall well-being. 5. What do you think are the most important qualities for a nursing assistant in a long-term care facility? Compassion, patience, attentiveness, and strong communication are essential qualities for a nursing assistant in a long-term care facility. Residents often depend on us not just for physical support, but also for emotional reassurance and companionship. Being dependable and respectful helps establish trust and creates a safe environment for residents. Attention to detail is crucial when monitoring changes in health or behavior. Patience is key, especially when caring for individuals with cognitive impairments. Strong interpersonal skills help build rapport with both residents and their families. Ultimately, a great nursing assistant is someone who treats every resident with dignity, empathy, and genuine care. 6. How do you assist residents with activities of daily living, ADLS, such as bathing, dressing, and feeding? I approach each ADL task with respect, ensuring the residents' dignity and comfort are maintained at all times. For bathing and dressing, I offer choices in clothing and explain each step to promote independence and reassurance. I assist gently, using proper techniques and allowing residents to do as much as they can. During feeding, I ensure meals are appropriate for their dietary needs and assist at their pace, encouraging them to eat without feeling rushed. I also maintain a clean, safe environment and document all care provided. My goal is to support their independence while offering compassionate, efficient assistance when needed. 7. What steps do you take to prevent pressure ulcers, bed sores, in a mobile residence? To prevent pressure ulcers, I regularly reposition a mobile residence at least every 2 hours, using pillows or specialized cushions to reduce pressure points. I inspect the skin daily for redness, swelling, or breakdown, especially on bony areas. I ensure bedding is wrinkle-free and residents are clean and dry to avoid moisture-related skin issues. Proper hydration and nutrition are also important, so I monitor fluid intake and collaborate with dietary staff. I report any early signs of skin irritation to the nurse immediately. My focus is on prevention through diligent care, attention to detail, and consistent skin assessment and documentation. 8. How do you properly transfer a resident from a bed to a wheelchair while ensuring safety? I begin by assessing the resident's mobility level and reviewing any transfer precautions or care plan notes. I explain the transfer steps to the resident to ensure they feel secure. If needed, I use transfer aids like a gait belt or mechanical lift, ensuring the wheelchair is locked and positioned properly. I use proper body mechanics, bending at the knees, keeping my back straight, and staying close to the resident. To avoid injury, I guide the resident slowly, supporting them throughout the transfer, and ensure they are safely seated and comfortable. Afterward, I check their alignment and document the procedure as required. 9. What infection control practices do you follow to prevent the spread of illnesses in a nursing home? I strictly follow standard precautions, including proper hand hygiene before and after resident contact, wearing gloves and PPE when necessary, and disinfecting equipment between uses. I follow protocols for handling soiled linens and waste, using appropriate containers, and avoiding cross-contamination. I maintain a clean environment, encourage residents to wash hands, and stay updated on infection control policies. I adhere to isolation guidelines when dealing with contagious illnesses and report symptoms of infections promptly. These practices help protect residents, staff, and visitors from preventable illness, especially in vulnerable nursing home populations where infection control is critical for overall health and safety. 10. How do you take and record vital signs, blood pressure, pulse, temperature, respiration? I begin by gathering clean, calibrated equipment such as a thermometer, blood pressure cuff, and stethoscope. I explain the procedure to the resident to ensure their comfort. I take the temperature orally or using other approved methods, measure the pulse at the wrist for 1 full minute, and observe respiratory rate by watching the chest rise and fall. For blood pressure, I place the cuff properly on the upper arm and use a stethoscope to listen while inflating and deflating the cuff slowly. I document all vital signs accurately in the resident's chart and promptly report abnormal findings to the nurse. 11. A resident becomes agitated and refuses care. How do you handle the situation? When a resident becomes agitated and refuses care, I stay calm, speak in a soft tone, and try to understand the root of their discomfort. I never force care, but instead validate their feelings and offer reassurance. I might step away briefly and return later, giving the resident time to calm down. I use distraction techniques, humor, or redirection depending on their personality. If agitation persists, I document the incident and notify the nurse. I also look for any underlying issues such as pain, confusion, or fear. Respecting the resident's autonomy while ensuring their needs are met is always my priority. 12. You notice a co-worker neglecting a resident's needs. What would you do? Resident care and safety are always my top priority. If I observe a co-worker neglecting a resident's needs, I would first ensure the resident is safe and immediately address any urgent issues. Then, I would document the incident and report it to my supervisor or nurse in charge, following facilities protocol. I understand that reporting such behavior is crucial to protect residents and maintain ethical standards. I would never confront the co-worker in an aggressive way, but instead rely on proper channels to handle the situation professionally. Accountability and advocacy are vital to providing high-quality, compassionate care. 13. How do you prioritize your tasks when multiple residents need assistance at the same time? When several residents need assistance at once, I assess each situation based on urgency, safety, and individual care plans. I respond first to residents with immediate needs, such as those at risk of falls and pain or requiring urgent toileting. I communicate with my team to coordinate care and delegate tasks when appropriate. I also inform residents of slight delays to set expectations and maintain trust. I use time management strategies and checklists to stay organized. Flexibility and quick decision-making are essential. Prioritizing helps ensure that every resident receives timely, appropriate care while minimizing stress and maintaining quality service. 14. A resident's family member is unhappy with the care their loved one is receiving. How do you respond? I listen to the family member's concerns with empathy and patience, allowing them to fully express themselves without interruption. I remain calm, professional, and respectful, validating their feelings and assuring them that their concern is taken seriously. If the issue is within my scope, I address it immediately. Otherwise, I promptly report to the nurse or supervisor for proper resolution. I avoid making excuses and instead focus on finding a solution that ensures a resident's well-being. Good communication and transparency are essential in these situations to rebuild trust and demonstrate a shared commitment to excellent resident care. 15. Describe a time when you had to respond to a medical emergency. What did you do? While working in a nursing home, a resident suddenly became unresponsive during breakfast. I immediately checked for responsiveness and breathing, then called for help and activated the emergency response protocol. While waiting for the nurse, I ensured the area was safe, monitored the resident's airway, and stayed by their side offering reassurance. When the nurse arrived, I assisted by gathering equipment and reporting what had happened. Afterward, I documented the incident and checked on the other residents to minimize distress. My calm, quick actions and knowledge of emergency protocols helped ensure a timely and coordinated response during a critical moment. 16. How do you maintain patient confidentiality and respect residents' privacy? I strictly adhere to HIPAA guidelines and facility policies to maintain confidentiality. I never discuss a resident's medical condition or personal information with unauthorized individuals, whether in person on the phone or in public areas. When assisting with personal care, I always close doors or curtains and ensure the resident is properly covered. I also knock and ask permission before entering rooms, respecting their personal space. When documenting or accessing resident information, I do so discreetly and only for job-related tasks. Respecting privacy not only protects residents legally, but also builds trust and upholds their dignity and rights as individuals. 17. What would you do if a resident confides in you about being mistreated by staff? If a resident confides in me about mistreatment by staff, I take their concerns seriously and reassure them they are safe and heard. I gather as much information as possible without pressuring or leading the conversation. I immediately report the allegation to my supervisor or nurse in charge, following the facility's abuse reporting protocols. I document the incident accurately and objectively. If the resident is in immediate danger, I ensure they are safe while waiting for the appropriate personnel. Protecting residents from abuse is a fundamental responsibility, and I always advocate for their safety, dignity, and well-being. 18. How do you ensure you follow HIPAA regulations when discussing residents? To comply with HIPAA, I only discuss resident information with authorized healthcare team members and only when necessary for care. I avoid discussing resident details in hallways, elevators, or public areas. When documenting care, I make sure the charts are stored securely and never leave personal notes unattended. I don't share information with family members unless they are approved contacts and consent has been given. I always verify identities before releasing any information. Understanding that residents' health information is private, I treat it with the highest level of confidentiality, ensuring trust and legal compliance at all times. 19. How do you communicate effectively with nurses, doctors, and other healthcare team members? I maintain open, respectful communication with nurses, doctors, and other team members by clearly and concisely reporting observations, changes in residents' conditions, and completed tasks. I use proper terminology and follow the chain of command. I listen actively during handoffs and ask questions to ensure I understand instructions fully. If I notice something unusual, I report it promptly with specific details. I remain professional and cooperative during team discussions and prioritize collaboration for the residents' well-being. Good communication helps prevent errors, builds teamwork, and ensures the delivery of safe, coordinated, and high-quality care across all departments. 20. What strategies do you use to build trust and rapport with residents? To build trust and rapport, I treat every resident with kindness, respect, and patience. I take time to learn about their preferences, routines, and life stories, which helps me connect with them on a personal level. I consistently show up on time, keep promises, and maintain a positive attitude. I actively listen, offer reassurance, and involve residents in their care decisions to promote a sense of autonomy. By being dependable, empathetic, and attentive to their emotional and physical needs, I create a safe and comforting environment. Establishing trust enhances communication and cooperation, which is essential for delivering quality care. Thank you for exploring the top 20 nursing assistant nursing home interview questions and answers. Mastering these responses will help you demonstrate your compassion, skills, and professionalism, essential qualities in long-term care. Stay prepared, stay confident, and make a meaningful impact in your caregiving career. Best of luck in your interviews.